Okay. All right. Good morning and welcome to the July 29th, 2021 meeting of the Needham Board of Health. I'm Rob Partridge, Chair. This open meeting of the Board of Health is being conducted in person and remotely per the Governor's Executive Order of 3/12/2020 due to the COVID-19 pandemic and is being recorded. Public access is available both in person and remotely. I'll introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Steve Epstein?
Yes.
Christina Matthews?
Yes.
Kathleen Brown?
Yes.
And Ed Cosgrove?
Yes.
Okay, and other participants, Diana Acosta?
Yes.
Karen?
Yes.
Mary?
Yes. Lynn Schiff.
And Lynn. Thank you. And Tim
McDonald.
McDonald.
Yes.
Okay, so we'll open the meeting with first with the review of the minutes from June 9th and then June 23rd. Do board members have comments on the minutes?
I had one on page 7 under the Nuari piece.
This is from June 9th.
Oh, sorry. Yes, from June 9th. Oh yeah, so where it says, oh yeah, okay, so it's that second sentence. Oh no, it's the last sentence of the first paragraph. He suggested that the board clarify its position further, that it is indeed against racism, but is unable to make the time commitment to fully endorse intentional practices. But I don't think that was exactly what was said, not the time commitment, but
Yep.
you know, the ability to ensure that we could cover all of, you know, the breadth of those practices.
Yes, and we do have one item later in the packet where primarily Lynn, but also the staff talked about what they thought we have already done and what we could do.
Yes, yeah,
But yeah, that wasn't correctly worded from the
Okay.
minutes. We can make an edit there,
okay.
definitely.
Other comments about June 9th?
I'll move acceptance of the minutes.
Second.
Okay, all those in favor with the amendment tabled by Christina? Say aye.
Aye.
Aye. Okay, unanimous vote. We'll move on to the June 23rd minutes.
Mhm.
I did not have anything on these minutes.
I move acceptance.
Second.
Okay, all in favor say aye. Aye. Okay. All right, minutes accepted. So we'll move on to the staff reports, and it looks like first up this month is Mary Ann, but I don't see her here today, so.
So Marianne is online
Oh, great.
on Zoom. I think this might be one of potentially the challenges, I guess, because, yes, sorry,
Right.
thinking through the technology. I have my Zoom on. If I turn on the volume, let's see,
That large screen doesn't work.
not with this laptop, unfortunately. It also confuses the camera because the camera thinks it's a person that's moving. Marianne, can you please provide your monthly update? We might have to move on to the next person.
Okay. So next we have environmental health.
That's me.
Excuse me, I'm here now. Can you hear me? Can you forgive me for just jumping in like this? But the stuff disappeared from my screen. Can you hear me?
Yes, we can. Please go ahead.
Okay, good morning. No changes and no additions to the monthly report. Are there any questions?
It looks like the numbers are very stable between the last few months anyway, between 2020 and 2021.
Yes, yes. And the summer could traditionally be down a little because family members take their family member on vacations with them. So, but we're pretty steady and the same people consistently for a number of years with a few new additions. Nothing dramatic for the potential stopping of the Center at the Heights meal program. I've only had 2 people that were interested in coming on the program, and they are clearly qualified. That's it.
Okay, thank you very much.
You're welcome. Thank you.
All right, so moving on to environmental health then, Diana.
Oh no, Tyler's off today, so it will just be me today.
Ally is on to cover the pesticide issue at the end of the.
Okay, perfect. So starting with Ally Littlefield's our new intern. So she started this month, has started helping us with what used to be Nourishing Needham. Now I believe it's called Nutritionally Needham. So we're going to start up that healthy eating program again, hopefully this year, where she's partnering up with different restaurants, and we're trying to create a campaign to promote healthy meals at different restaurants in town. Big thing that I had to deal with that I wanted to present to the board today was I had to issue a cease and desist for chickens at a property on Gould Street. The reason I wanted to bring it up to you guys was the person who lives there has consistently been trying to amend their permit packet. Unfortunately, their backyard does not meet, the regulation. So in the regulation, they're supposed to build a sufficient coop. The facility which the animals are going to be staying in has to be at least 30 feet away from the rear line of the property and the side lot line. So 30 feet on either side. The whole backyard is 34 feet by 32 feet. Can't really have a 2x4 box for 4 chickens. He wanted to try to see if they could get less chickens. The issue that I found was when I went there, I was called by the animal control officer who's currently out on leave. So I went to go support because we got a complaint about a rooster on the property, which, as you guys know, you need a variance for. There was no permit. I had told this resident that they needed a permit a while ago. There's a little bit of a language barrier there, I think. So I was talking it over, but it was just, I don't know if you saw the letter, if I included it, but it was just like a little plastic fence. He had kept them in the basement for a while to raise them. And then I had to explain, can't have chickens indoors. There's reasons why they have to be outside. But I just wanted to present it to you just because this person was very adamant about getting them. But I feel that it's a difficult situation only because there's not enough space. It doesn't meet the regulation. We have never really granted a variance before for the coop to be so close to the neighboring house.
Well, we have usually asked the neighbors for their support.
Right.
So if the neighbors were fine with it, he could apply for the variance.
Okay.
With the neighbors' support, he might get it.
All right.
That's an option for him.
I do believe this person has had issues with his neighbor and has.
Yeah, the neighbors
Like I
who
said,
called
the neighbors
me.
might not give support,
Yeah.
right? But it's an option.
It
Okay.
is.
The other thing is, did you have an interpreter with you when you were?
He spoke English and he was trying to nitpick at our definitions. So I feel like he had a bit of an understanding.
Okay.
Because he was trying to say, in our pets definition, it included domestic and exotic birds. So he's like, chicken, bird. And I'm like, chicken is poultry. Poultry falls under the definition for the domestic animal permit. So it was little things like that that I feel that he has a good understanding of what was required, what is required. But I can let him know about the neighbors. So.
But this came up because a neighbor.
Yeah, this came up
Complained
because
about
a
the
neighbor
rooster.
complained about it, yes. And it turned out there was actually 2 roosters on site. I thought it was 2 chickens, 1 rooster, 2 roosters. 1 chicken was found, unfortunately, in a box separated. Its leg was broken, had to get euthanized by Animal Rescue League. So that was another reason why I was a little hesitant to issue a permit. So didn't know if anyone had any recommendations, but I can also extend to him if he wants to talk to the neighbors and see how they feel about it.
Yeah, well, he can apply for a variance on his own.
Right.
He can come to us. We're unlikely to support it unless he has, the consent of his neighbors and a coaching plan.
Gotcha.
So if he wants to develop that, he's more than welcome to apply for variance. But I mean, that's an option as a citizen, right?
100%.
When we issue permits for keeping poultry like this, is there some sort of training that people have to go through?
Not a specific
No.
training. We give them educational work, like PDFs and everything. Animal Rescue League actually gave me more information, which was great. So after that incident, I did pass along the packet of information so he got more of an understanding, because I think it's a cultural thing too. So he grew up with chickens. He's from China. It makes sense. They grew up, had chickens running around wherever. So he thought, I can do the same. His wife had called me because I guess it's helped his mental health to have them there. But I have suggested maybe getting a rabbit or a parakeet, like another type of animal that wouldn't fall under the domestic animal permit. So he could still have an animal, just wouldn't be the chickens. So
How far, like, how much space is he short on the?
So
spaces? Is it a big
the box, I
difference?
believe it was 8 feet by 4 feet, so it would be like 4 feet short. But when he gave me his plot diagram, where he had it in his backyard, it was only 11 feet from the rear line and 13 feet from the side lot line. So it wasn't big enough, but. Is there anything else that may have popped up? Because the Kendrick I will be talking about later. We did a compliance check finally, first time in a long time. It was actually Tara's son who volunteered, which was nice. Everyone's fully vaccinated, so I went out with Officer Adrian Anderson. It was one of the quickest tobacco compliance checks we've ever done, because now we only have 6 licenses. And Dan's very tall. He looks older, but everyone was just like, no, you can't come in here without the ID, which was nice. Because since it's been so long, I'm happy that every single person asked for ID. So that was good.
Good.
And is there anything that may pop out that you would like me to go over in the report? I think those were the major things.
Just like the pest stuff and I mean, you don't have to go over it, but I know it's been an issue that's been coming up with so much outdoor dining and all the Jersey barriers and stuff. So I know that's on the radar.
Yeah, we're working with that pest control company that the town hired. There's been other places beyond what we have them contracted for to take a look at. So it's been helpful.
Okay.
Yeah.
Great.
So year and a half or 2 years ago, the finance committee moved what had been under building maintenance, which was the pest management contract for public parking lots, to the public health division. The building maintenance department still has the pest management contracts for town and school buildings. There are spaces that maybe slip in between. So like I think it's the Avery park that's the little sort of common right near the Heights. And Rich Pollock, a resident, had emailed Kathleen and I about it. We did have our pest management company go over, and he had some suggestions, although he didn't think it was rats. So I know Rich is an expert, but we did have him go in. I think we're going to try to expand the value of the contract to cover some additional public spaces that fall in between the town buildings versus the parking lots. The one challenge we have is competitive procurement. We set a contract at the beginning of the year for the total value of town and school services. And we did it by bid. So we have limited ability to increase the value of that contract until September 1st or October 1st. So we're going to try to figure out how we can provide some services, and then with the start of the new agreement, have a more comprehensive agreement in place.
Cyber inspection went well in Milford.
Yeah, went totally fine. It was actually very interesting. They got new machinery. They're kind of upping production. They're actually building a 3rd facility. So right now they have the main building, which I saw. We went to the 2nd building so the main building is where they do all the processing, cooking for like any edibles. That is like the main part. They had a 2nd facility where they were growing additional plants, and that's where they were still hand cutting, preparing plants there, but it wasn't as much of an operation as the main building. But they're planning on expanding to a 3rd building to just up the production, because I believe they do wholesaling as well. So they sell to other companies. So then they're just upping production, but everything I saw clean, sanitary, everyone was wearing gloves. They had their serve safe in the kitchen. Kitchen was well run, nice and neat. They're only doing gummies right now, so it wasn't too intense of a production. But even in the lab spaces, like everyone still wearing masks and taking precaution. I thought it was very well run, but it went super well.
There was a meeting earlier this week with the town manager, the assistant town manager for finance, myself, and some of the corporate finance people for Sierra to sort of review changes to potentially the community benefits agreement, because at the time it was signed, it was, I think, Sage Naturals, not Sierra Naturals, and the signer of record was some person who's since moved on. Sierra did indicate an interest in engaging with the health division and then the Board of Health on some hoped for changes. I said the board is always open to talking about changes, but would want to understand the rationale and would want to feel it was compelling. They have the state allows right now any one company to have 3 medical licenses and 3 recreational licenses. Needham has a medical license in addition to their manufacturing at Milford. So they're looking to open a store in Watertown, which would be both medical and recreational. They're looking to open a store in Boston that would be only recreational. Their Somerville store, which is currently medical, would expand to include recreational. So they'd have Watertown and Somerville would be both medical and recreational. Boston would be recreational, Needham would be medical. That would mean they'd have the full extent of their licenses, and I believe they're in the process of building out those facilities. I think the issues probably that will come up would be question about hours. They ask every year for a variance around the April 20th. The discount question, which they've asked about in the past, and like a veterans discount or something like that. And then the question of employees. So right now, an employee, if they wanted to sample a medical product, which I think is a question of, are they just sampling a product, or is it actually appropriate for whatever condition they are trying to treat with that medicine? It's a question of right now they have to go to Somerville, buy the product. They can't buy something in Needham. So they have a question about, and they want to talk a little bit more about that. So I anticipate they'll engage us later this summer about it and maybe want to come to the board in September or October to talk more. I did reiterate what I think has been the board's position in the past, that it respects how well Sierra operates and that it's pays attention to the details and that sort of thing. But the board has always sort of tried to treat it like a pharmacy providing medical medicines and medical treatment rather than a sort of store. It likes that sort of fairly clear division between this is a store providing medicine as defined in the Commonwealth versus this is a marijuana establishment where people are sampling different products, for example. So I anticipate they will want to come before the board in either September or October, and I'll keep you informed about that.
Okay.
Do we want to ask Allie to give a brief update about pest management now? Allie, if you don't mind unmuting. I think actually only Rob is aware of this. Rob, this is a follow-up to the meeting that you and I had with a concerned resident about the use of pesticides in the community.
Yes.
So Allie, go right ahead.
Yeah, sure. So we're going to be meeting tomorrow. We have a group of stakeholders that we're going to talk about, this campaign to reduce the pesticide use in the town. So pretty much our goal with this is just to present the knowledge in a transparent manner on the health and the environmental risks of pesticides. And then we also want to provide them with adequate resources. That way they can make that switch to either an organic method or alternative method. And our focus is more on kind of the lawn care and yard aspect of that. But yeah, that's pretty much what we've been doing. So I have been working on a PSA, an infographic, and a pamphlet to distribute throughout the town.
Thank you, Allie. This is a resident that some of the board might be familiar with who's very fierce in her advocacy for low chemical, no chemical use. We have worked with her before, and certainly her sort of desired opinion is probably in the regulation prohibition realm. And I think where we are comfortable is, advocating for less chemical use, advocating for more sort of organic uses, and educating and informing people rather than requiring or banning. So there is certainly some tension, but we're working to address this resident's concern. And we think it does fit into the board's goal generally of a healthy community. And we can, advocate for people to use organic fertilizer. We can advocate for them to use organic pest control methods or very limited chemical pest control methods.
So we've always advocated for integrated pest management. That's where we have been.
Which is what the town employs for both school buildings, which is required by state law, and for town buildings. Yes.
And the golf course, I think we do integrated pest management there.
We do. I think the position probably of this resident, without trying to speak for her, would be that is insufficient and it should be much more stringent. And,
Has it been a health issue this time around?
the resident believes there's a personal health issue. And I think you're familiar with the resident.
If I recall, the last time there was actually an inappropriate application of a pesticide to a public space that generated that. That's why I'm wondering if that's what occurred this time or something like that.
So there has been road construction in front of the residence who has a chemical sensitivity, and there's also been construction of a large house right next to her property. So I believe she's frustrated and feels personally and health-wise affected by those actions. But those aren't things that we can control. It's actually not a town project, it's an MWRA project. And the construction obviously is a private developer and a private landowner.
Right.
So this is one sort of small way, I think, and Rob was part of the conversation with a number of town departments where this resident indicated that she believed she had a disability that the town was not providing reasonable accommodations for. The Department of Public Works and Engineering and others were basically unable to accommodate her request for notification of when projects are going to be done in close proximity to her home, which they're hoping to improve with a GIS system that's hoping to come online later this year, but they had no ability to sort of accommodate her in the short term. So we did offer, with the help of an intern who's Allie, who was started relatively recently, to do sort of public messaging and advocacy about lower chemical use from people. We think that sort of fits in with part of the board's goals. And I think you're right, we prefer integrated pest management. We think that's a proven practice. But there's nothing wrong with encouraging homeowners to think carefully about the fertilizer they use. We know there's a number of affected water bodies in town that have had high nitrogen loads and have
Right, there just seems to be a disconnect between what's going on around the home, which is more of a general chemical sensitivity, and then a specific action by Board of Health on pesticides as opposed to other chemicals.
Sure. So I think we're hoping it'll be chemicals, pesticides and fertilizers, but it's not that the board, or I don't contemplate, unless the board indicates there's an interest in considering a ban on pesticides or a prohibition on sale of fertilizers or pesticides. I think what we took as a relatively innocuous but appropriate role would be to inform and educate people about potentially the benefits of using organic methods, and letting people decide for themselves.
That's not what I'm getting at. Okay. I think that, that's fine, but if the issue here is a chemical sensitivity to construction around the home, all right, has nothing to do with pesticides.
Yes, I think this resident is still focused on the issue you talked about, which was a pesticide-related exposure from a town building that was where it was inappropriately applied about 15 years ago.
Right. All right. Fair enough.
Is this something that you mentioned other town bodies are also interested in this? Is this something that Green Needham and other community groups are?
So Allie, correct me if I'm wrong. I believe Green Needham is one of the invitees.
Yes, they are. And two of our materials are from Needham, which were used a few years ago, maybe 10 years ago. We kind of revamped them and just updated them a little bit. So they are resources from the town as well.
Okay.
And so the Ed Olson, who's the superintendent of Parks and Forestry, he's very focused on organic best practices. He strongly believes in IPM, but in terms of like, he uses very limited fertilizer on the fields. He overseeds. There's different ways that he works to grow grass with using less chemicals. He's going to be part of the meeting. Green Needham, a couple different community partners. The town board that originally brought this to our attention was the Disability Commission, because this resident had made complaints to the Disability Commission at both the local and the state level about the town, her perception of the town's lack of responsiveness to her disability and the accommodation she was asking for. So
There were other issues as well. At least one that I can remember is the issue of machinery and trucks idling on outside her house. And
yes, and I think
related to
there's
that. And
right, and I think there's certainly some issues there, and I think it's a challenge when the town informs contractors of work requirements. Its ability to, beyond occasionally checking on them, is limited. So if they're idling in their truck for an extended period of time, we can go out and try to stop them, but chances are they've stopped idling by the time we arrive. Obviously, that's not a lights and sirens issue. So.
And relative to pesticide regulation, aren't we preempted by the state or federal level?
Yes.
No, or we can only do so much.
That is true, yes. Which is why we're really focusing on educating and informing, and maybe, a newspaper editorial, or, a couple of social media tweets, or, that sort of. But we think it's a good project. We think there's value in engaging with those stakeholders. And we're happy that Allie's going to be part of it, in addition to her other work with, which Diana talked about, with food safety and nutritious eating.
okay, thank you, Allie. We should move on to public health and nursing, I think is next. And I don't know who else is
Sure, sorry. So
with
that's,
us.
That's one of the interesting aspects of doing this
Right.
partial
So-
in-person, partial hybrid option.
So, yeah,
No,
We do have Mary in person.
Yeah.
So Mary's the one who's going to handle the public health nursing update. And then Mary and Hannah later will help handle the COVID update. Mary and Hannah Whitehead, who's on the line.
So, yeah, it's just me in the nursing department currently, but primarily been doing summer camp inspections and doing licensure on, we've done 4 camps starting, and we're working on opening up, or there's a 5th that should be starting next week or the week after. There was a severe weather presentation done for residents and patrons of the CAF on Zoom. Tiff taught a CPR class. Taleb organized and ran an MRC training also on Zoom. And then I've been on COVID, which we'll talk about with our epidemiologist, Hannah Whitehead, here shortly. Hannah Burnett is working on the concussion rollout. When she returns in early August, that's when we're going to really get rolling on that with a training info session, and all the various sports organizations have been contacted, and waiting on an inspection from the state. No idea exactly when that will happen due to COVID and a backlog, in order to expand our vaccine offerings and get registered again as a pediatric vaccine supplier. And I applied for and received a grant from BID Needham for $900 for to order bulk Narcan in order to start a take-home naloxone program that Karen and I will, that shows up a little bit later also in the meeting today. The June numbers are in here for COVID, and COVID was pretty boring for June. And then we are seeing an uptake on Lyme and other tick-borne diseases, as we kind of expected for this year. If anybody had any specific questions, I would be happy.
how much bulk Narcan can you get for $900?
Depending on how I order it, if I can get it through Narcan Direct, that is a case of 12 cartons, and each carton is 2 doses. So the idea would be to pilot out a program, and I've got a quick presentation for that towards that I did with Karen.
Okay, all right.
$900, you only have 24 doses. Ouch.
Yeah.
If I were to get it through a pharmacy, it would be $40 more per carton, and then trying to source it from, say, the ID Needham pharmacy would be another $15 or $20 on top of that. So it's the lowest price I could find through a few months of digging. But yeah, it is a little bit steep.
Yeah, it seems out of proportion for generic, that's why.
Right. My guess is that the price has increased substantially over the last sort of 4 or 5 years. I bet it was,
Actually-
like many other drugs,
Yeah.
cheaper before.
And also there's a difference between doing Narcan and just straight naloxone with the aerosol tip, the aerosolizer. So this is a trade name. So just like other trade name medications, there is a little bit more for that you're paying just for the Narcan dispenser, which
Yeah.
is really important when we're talking about doing public outreach. We don't want to try to teach them how to adapt a cheaper version of
Yeah.
generic naloxone.
Okay, questions for Mary on public health nursing? Before we go on to substance abuse prevention. Karen.
Good morning, everybody. The month of June saw us doing a number of things in preparation for the upcoming school year, but I'll start with a couple of notes on grants. Our vaping grant through the Metro West Health Foundation has been extended. Our deadline was originally August 31st, and we requested an extension, which they approved until next spring. So we're pleased to be able to really kind of relaunch the vaping cessation program at the high school. While we rolled it out last year in conjunction with the school nurses, given the circumstances with the pandemic, we really felt as if it didn't get as much attention as it could warrant. So we're excited to be able to relaunch the cessation program at the high school in the fall, and having that extension is great. We also are moving along with our STOP Act grant, which we received a few months ago. It is a 4-year grant specifically focused on underage access of alcohol. And while it isn't quite in the June notes, but I can give you a quick update, we did hire a part-time person just a few days ago who will be joining us soon to help with the administration of that grant. So we're excited to have her on board. More on that to come. And just in terms of summer projects, our community action team has decided to continue to meet through the summer to keep momentum going on an impaired driving and cannabis use PSA campaign. The community action team has been really prioritizing awareness around impaired driving, and we were able to recruit a couple of high school students who are going to work with RJ Poirier of the police department and Officer Rocket, the community service dog in town, to create a PSA that will be educational but appeal to our target audience, which is really teens and young adults. So the whole idea is friends don't let friends drive high. And that's echoing what we remember as a really popular campaign years ago about friends don't let friends drive drunk. So we're hoping we'll see some completion of that this summer with that video. And I'm also pleased to announce our salsa students, we mentioned this at our previous meeting, but by the time school ended this year, they had completed nearly 1,500 hours of community service, 1,470 to be precise, and which is a tremendous amount of effort. And despite the pandemic, those hours are, a 50% increase, I think, from last year. And one of our salsa students was selected as an intern this summer in Congressman Jake Auchincloss's office, which is quite an achievement. And I can point back to the fact that this young woman, Needham High School rising junior, I believe, did a policy advocacy effort with representatives from his office, with his staff, in the spring, where she was part of the 84, which is an anti-tobacco advocacy movement for youth in the state of Massachusetts. So she really not only sparked her advocacy skills and interest in government and public policy, but in applying to this position, it was a highly coveted seat. So we're really proud of her for getting that. And other than that, I'd say just one last thing. The Metro West Adolescent Health Survey is planned to be administered this November. In fact, I think the schools have just arrived on the date of November 3rd. It'll be an online administration of the survey, which was scheduled to happen last fall, but was postponed because of the pandemic. So that's the Metro West Adolescent 2021 survey for 6th through 12th grade.
One question. And I
Yes.
suppose it hasn't been possible to collect good numbers. What's the status of vaping use in high school now? Has the numbers gone down, or is there any indication?
We unfortunately don't have any direct numbers about the use in our high school. We really didn't see any surveys done over this past year. Now we would have, if we had had the Metro West last fall, we would have had that data around
Yeah.
now. But unfortunately, more of our information is anecdotal. We are in touch a lot with our Needham Youth and Family Services clinicians, and they've seen a huge uptick in their clinical practice with a very long waiting list for young people to see them, but have noted that along with mental health, substance use has been coming up fairly often. But unfortunately, I don't have specific metrics on vaping, which is concerning.
Yeah, it'll be interesting when that data does come.
Yes.
You know, especially after all the state law changes and other
Exactly.
interventions that were made to stop that about a year and a half ago. Okay, thank you, Karen. Those are great updates. So
Next item is a COVID-19
COVID,
update. And so I believe Hannah, Mary, and I are going to go through the slide deck. But then there's probably another couple issues to talk about, including the recently released CDC guidance, as well as probably some additional information that Mary can talk about the number of cases. So there's a very simple slide deck for the board. You can see our 7-day rolling average through the course of the pandemic, along with the total cumulative cases, which has been relatively steady through June, is now ticking up again in July. Mary, would you go over case investigation?
Yeah, absolutely. So our part-time contact tracers left June 30th, and I hadn't had very many cases at all. We were able to kind of cycle them into other forms of COVID follow-up. And then as soon as they left, of course, cases started ticking up. So most of the work we're doing with CTC right now is based on the CTC shuttering in September and trying to make arrangements with local colleges and the few things that CTC was doing for us and take back over or make plans for exactly how that's going to run in the fall. We are still working closely with Needham Public Schools in terms of anything that comes up over summer programs. But we've had not a lot of contacts. I think this comes up in a slightly later slide. Our current case list, which is the third slide there. This is in regards to July now rather than June. And this, I don't think, reflects the 6 cases I had come in yesterday. Thankfully, I just checked when I sat down and I had none in the queue for today. So a slight reprieve. From the people I've talked to anecdotally, the vast majority of our cases are related to travel, either people coming into Needham to visit or Needham residents going elsewhere, with a note that I have asked literally everyone, and there has been no connection to P-Town for any of our Needham cases. And then most of our cases are also either fully vaccinated or under the age of 12. So majority of our cases are vaccine breakthrough. The big difference that I've seen now, as opposed to what we were seeing earlier in the spring, is that I'm not seeing a lot of household transmission. So I'm seeing people essentially bring it home and then nobody else in the household get it. So I do think that's probably the biggest benefit from our vaccination status here in Needham with how much vaccine coverage we have. And so I have been trying to track household contacts and haven't seen a lot, and we've had almost no contacts outside of the household, as people do seem to be kind of self-quarantining after travel.
Do you know how many hospitalizations?
I have not encountered any. I haven't seen any actual data on that, but of everybody I've talked to, everybody I've spoken to, and I've spoken to everybody but 3 at this point. Everyone I've spoken to has been mildly symptomatic or asymptomatic and stunned. But I have not encountered anybody who's even reported shortness of breath. So it's been complaints of a bad head cold, which it's a coronavirus. That's ideally what it should be.
The cases related to travel, they were tested because they were coming from international?
Most of them actually were, I did have one who was international, was actually symptomatic as he arrived home. And then in terms of related to travel, then that individual tested positive off the plane before their spouse would allow them into the house. And then the friend who picked them up at the airport tested positive. And then the friend who picked them up at the airport's wife tested positive. So the travel related. One was, an individual who was on Cape with friends they found out later tested positive, and they're like, oh, maybe this head cold is something else. And then went and got tested. But, it's been that sort of story over and over and over again. I was here, or I came home from, I live in another state and I came home to visit family. They made me test when I got here. I'm positive. I've been isolating in the basement, like that sort of thing.
Mostly symptomatic.
Mostly mildly symptomatic, yes.
And did you get a sense for whether, was it air travel or was it more just local
A
travel?
little bit of everything. A little bit of everything.
Okay.
Definitely some air travel, but then also just the, I drove in, or I was in, one of the surrounding New England states at a family function, and then came home and found out everybody else in the family is testing positive. So I got tested and oops. So.
Okay.
Hannah, do you mind taking the next couple of slides, COVID cases by age?
Sure. Can you hear me?
Yes.
Yep.
Yes. Okay, great. So just a snapshot of where we are in terms of the age breakdown. Again, as we've kind of been seeing over recent months, have kind of even spread overall. In July so far, almost all of the cases have been under 65. So we're not really seeing any cases in that really high risk group. And about a quarter of the cases have been in youth so far. And obviously some of those might be vaccinated. We can go to the next slide. So I think these are graphs that I've been showing you all for a few months now, but just kind of tracking our vaccine uptake. It definitely has more or less leveled out over July. Every week we are seeing the numbers increase slightly, but the coverage has pretty much leveled out. About 80% are fully vaccinated, and that includes, about 16% of the town is under the age of 12, so they're not even eligible for vaccination yet. On the right-hand side, you can, sorry?
We just seem to have a stubborn number of people who are only partially vaccinated.
Yes,
really
and so the bar graph shows that you can see, and it's a bigger number, I guess, in the kind of middle age 30 to 64, and then bigger again among the 12 to 15-year-olds, but that I think is just a timing thing. They're still getting their second doses, but I think, moving forward, as it seems like, the majority of people who can get vaccinated have been, it's, this kind of stubborn last small slice of the population where they've gotten their first dose, but they haven't.
Concerned that it's more than that. I mean, looking at these time graphs here, there's been plenty of time for a lot of these people who are supposedly partially vaccinated to have gotten
Yeah.
their second shots, and they haven't.
I'm particularly interested in the 12 to 19 cohort there.
Yeah, is that families
Yeah.
choosing to dose a low, give their child a lower dose essentially by only doing one? Do you know what I mean? Like the
Or
thought
try and
of,
spread them out.
yeah, or spread them, wider.
I think I have the number on one of the later graphs, but yeah, I kind of looked with like so obviously all of the 12 to 15-year-olds are getting Pfizer, which is a 3-week interval. Even giving 4 weeks, it's almost 400 of them who have not yet gotten their second dose. So definitely something to keep an eye on. I know, when we first started vaccinating this age group, there were some lags in the data reporting. So I don't want to say that definitively that this group of 400 are not going to get their second dose in the next week or two, but definitely something to keep an eye on. Yeah, so this graph is just showing fully vaccinated coverage among the 12 to 15 age group, and then the 16 to 19-year-olds. So you can see
So that's a big concern with school coming up soon. And
Yes.
I think maybe we can get a message out through not only the schools, maybe with the communication with the information officer about reminding families very important to get this done
Yeah,
at least 2 weeks before school starts
yeah.
for the second dose.
Yeah.
Maybe provide some numbers like, you're only X percent,
Okay.
with one dose and the second dose.
Sure. Can definitely work on that.
And then obviously with now the uptick we are seeing everywhere with Delta, we wanted to kind of look at some of the trends of, how cases are mapping onto hospitalizations and deaths. So we don't have this data for Needham specifically, but we have the hospitalization data at the state level. So the upper graph is just over the, last 11 months. You can see generally how hospitalizations obviously have tracked with cases. And then in the zoomed in graph on the right side, this is just since May. So hospitalizations are going up a tiny bit, but they're really pretty much staying flat, even with the increase in cases, which is kind of consistent with what we're hearing, even within Needham, that these are generally very mild cases that aren't meriting hospitalization. And then similarly for deaths. So this is at the county level. Again, deaths are still pretty much overall declining down, even in the last month or so. Obviously, there will be a lag on this, so it's something we'll keep an eye on moving forward, but it doesn't seem to be ticking up, which is encouraging.
Great. Thank you, Hannah. Board members have further questions for Hannah about the data. Okay.
Thank you very much, Anna. We probably do want to talk a little bit about the CDC guidance, which just came out 2 days ago. And the gist of it was essentially that in communities with substantial or significant transmission, which in Massachusetts right now, that includes Dukes, Nantucket, Barnstable, Bristol, and Suffolk counties. The CDC recommends that everyone, regardless of vaccination status, employ masks in indoors settings. That is a CDC recommendation. Right now, the state has not responded to that recommendation yet, aside from say they've seen it and they're studying it. This was all fairly new. The state had a conference call on Wednesday right, a Tuesday afternoon, about 2 hours after the CDC made an announcement.
The
What are we
CDC,
defining as substantial transmission?
That's the question. 50 cases per
100,000,
100,000
yeah.
How
over
many?
7.
Sorry.
50 cases per 100,000 over a 7-day period. So for Needham, that's 15 cases a week.
And over the last week, we've had 16 cases, is that right? I know that the data that Hannah pulled is essentially as of last Friday, but over the like July 21st to now.
Today, yeah. I think from the 21st to the 28th, but yeah, we're pushing up. I believe she said the rate was 4.2, 4.7. Hannah? Is she still?
Yep, Hannah's still here.
Sorry, I was just counting on the line list from today. Yeah, what I calculated yesterday, yeah, our rate was about 4.2 per 100,000 as a 14-day average. And yeah, it
The
does look
CDC's
like
metric is different.
Yeah, the CDC's metric is different from the state's metric.
cumulative over the 7 days. So I can go in and calculate what that, using their way of their measure, what we would be, and I can follow up with that.
But I think we're slightly below, but potentially close to the CDC's measure. Mary, you had sent an email saying that July 5th through 7th, we had 6 cases. July 12th through 14th, we had 4 cases. July 21st to 24th, we had 9 cases. And then this week, the 26th, 27th, 28th, we had 6 new cases.
So,
Yeah.
and then I didn't have any come in this morning, but we're
Good.
still kind of sitting right on that line.
the other thing that the CDC said was that they recommended masking for students and teachers indoors, K through 12.
Yes. And that is different than the state guidance that had come out. I've got to be honest, I forget if it was 3 weeks ago or 4 weeks ago. The Department of Elementary and Secondary Education had released tentative guidance that said for vaccinated, for students eligible for vaccination, it wasn't recommending masks in school settings, right? For neither students nor staff. So like the high school or the Pollard, under the existing state guidance, if Needham chose to adopt that or use that, the Pollard or the high school would not have staff or students use masks unless they personally chose to.
Right.
The other difference in this new CDC guidance is close contacts, right? Is if you are, so previously they said if you're a close contact and you're vaccinated, you didn't need to do anything. Now they're telling you to mask for 3 to 5 days and get tested. That's different.
And will potentially, yes, and that will affect a lot of people given that one of the early indications for the Delta variant is much higher viral load, and the viral load stays in your system longer, so presumably you're contagious for a longer period. I don't know if that's confirmed, but that's the
I know
assumption.
you peak earlier. I don't know about the longer period. I thought
So
it was shorter, but
So I thought using the data from the Sports and Society, the conclusion was that you were potentially contagious for 7 to 10 days, is what I thought the conclusion was. Let me see if I can find that.
But 7 to 10 days would still fit within our current isolation period, which is 10 days from first positive test or 10 days from first symptom onset.
The other thing we got to take into account is the vaccination levels in Needham, which are excellent.
Yes.
Right, because most of this this guidance is really geared for areas with low vaccination rates.
yes.
Yes.
That's good. I mean, my take on this is that the metric of interest is hospitalizations and deaths. It's not illness, not mild illness. That's really going to be balanced into the equation here.
I agree.
I don't know if we want to spend some time talking about what we think that means for Needham.
Yeah, health and safety for the public schools is going to start meeting again on August 4th.
Yeah.
So that'll definitely be a topic of discussion. This is obviously a sort of a dynamic situation with the CDC changing its guidance, and then the state at the governor level figuring out how it's going to respond, and then the same with DC. So I think we're gonna, and you know, our numbers are changing. We're not necessarily in the CDC critical zone yet, but
Right.
we don't know what's going to happen over the next couple of weeks.
You know, I would expect that for us, K through 6 is a no-brainer, masks, everybody.
Yeah.
Right,
Yeah, I agree with that.
right, because that's our unvaccinated population. My
Right.
question is, you know, Pollard and up, where do we go with that?
So probably the High Rock, given
High
that
Rock
it's
masks.
11 and 12, we would assume that it would be
Yeah.
masks.
Yes.
Pollard and the high school, the question. I think one of the other questions, you know, Ed, thinking about it is, we were very cautious, the town was, in terms of closing the senior center very early in the pandemic.
Mhm.
And we just reopened July 5th.
I know.
Attendance is very, very modest for programs. Programs that used to attract 20 or 25 people have 4 or 5.
I know groups that I'm in, there's a great reluctance to go back up there.
And I don't know how that changes. You know, it's very hard for the town, thinking about its services, to do. It was hard, but we managed to do remote. It was a lot of changes from our normal operating procedure, but we were able to do it. We don't have the resources to do all of the things we were doing remote, but still offer in person.
Yeah.
So I think one of our challenges is figuring out, do we think this is an environment that's safe for youth in schools? Do we think it's an environment that's safe for town employees in town buildings? Do we think it's an environment that's safe for seniors who are going to the center of the Heights?
I think we really need to stress vaccinations, but I mean, it's judging from our numbers, it shouldn't be too much of a problem. But there are still some out there that aren't.
Yep.
Unfortunately, I don't think we can't ask them up there if they're vaccinated, but you can push vaccination anyway.
Well, you can ask.
Right.
You can walk in a restaurant and ask your server.
Well, yeah.
Doesn't mean they'll tell you.
Officially, you can't ask.
I mean, I think these numbers are not trouble. I mean, we weathered a major storm without vaccination, pretty much. I do not think it warrants closing any of these things for given the vaccination rates in our community.
Sure, and the fact that, as Hannah mentioned, as other people mentioned, the fact that total number of cases is decoupled from the sharp increase in hospitalizations and the sharp increase in deaths that have occurred during previous waves, that you could see cases, you know, essentially going off the charts, but hospitalization and deaths sort of barely moving the needle. I think it does raise some questions sort of psychologically about, you know, are parents comfortable with kids in schools? What is the appropriate sort of masking policy? And then thinking about our seniors, is it the case that they would be more comfortable with us delivering remote programs for a while? In reality, there's probably some people that will be on the side of I'd like all remote programs, and some people that would much prefer being in person. So you're trying to walk the middle ground and find a solution that supports both will be challenging.
Again, they're trying to figure out how to do a combination, sort of a hybrid program for a lot of those programs too.
Yes.
Typically is participation that low in the summer?
It does drop in the summer, although it drops, you know, from like 20 people in a class to like 14 or 15. There's sort of a core of seniors that used to be sort of present every day, and you knew the familiar faces, and there were some people who would come, you know, for particular classes or some programs, but there's others that would be there every time it was open for the entire length of time. Attendance is very, very modest right now. There are some challenges. We have a number of building repairs still going on. Floors are being replaced. Some later in August, some repairs are being done to the kitchen so that we can do food service again. But I think it is noticeable how few attendees there are.
Yeah.
It also, you know, not that it's the Board of Health's problem to solve, but it does get into the challenge of, we base sort of our budgets on trying to sort of break even between what we pay instructors versus what we take in for courses. And so when we're hemorrhaging money, and we didn't charge for any of our remote programs, which I think made sense and encouraged connection and reduced social isolation among seniors. I think it's still a worthwhile challenge to figure out. I do think that, as Rob mentioned, the Joint Health and Safety Committee is going to be interested in the board's opinion on it. I think one of the key messages, whether it was ever strongly related enough or whether it did get lost in the shuffle, was no one or very few people in the health and medical community thought vaccines would prevent everyone from getting sick ever. They thought some people would get sick. I think the hope was that you wouldn't require hospitalization and that you definitely wouldn't die. And for the most part, that's been entirely true. I think psychologically, though, people figured I'm safe if I have the vaccine. And does the fact that they got a case of COVID, does the fact that they maybe had a bad head cold, does the fact that they potentially were able to pass it on even though they were vaccinated, how does that affect psychologically how they're going to behave and what activities they're comfortable with?
Well, I think the big message coming from all this and from the CDC is that the way out of this, other than protecting yourself if you're unvaccinated by wearing masks and distancing, is to get vaccinated.
Yes.
So at least for health and safety, I mean, I think I'll sum it up. Our message, the message from our board is that we recommend masking for those who are unvaccinated. So kids and any teachers that are not vaccinated. Masks, of course, would remain optional for those who would choose to do that. We would definitely add to that we recommend kids who have not received 2 vaccines receive their second vaccine at least 2 weeks before school starts, and a message about that, and a reminder to teachers, but if they haven't been vaccinated, that we recommend that.
Okay.
So seem like a reasonable recommendation right now. May change if numbers change and state guidance changes.
Sure.
DC guidance changes.
Taken on a day-by-day basis at this point.
Yep.
You don't know where anything's going.
Yeah, I mean, the CDC has been jumping around, and they usually don't jump around so much, but it's a very dynamic thing. Okay. All right. Thank you, Hannah.
Thanks, Anna.
So next item up is Board of Health Priorities, Recovery Act, and Select Board Priorities. And this is coming from the meeting that Tim and I and Christina had with the Select Board to see if CARES Act funding or Recovery Act funding that Needham was expected to have to receive could be accessed by Health and Human Services. Our discussion with them was focused very much around sort of mental health, substance abuse, a little bit about bullying issues in the Metro West Adolescent Health Survey. They were certainly receptive and I think shared our concerns, but they wanted us to come up with an ask, like, how much we're looking for, and exactly where it's going to go for programming and other things.
Right. I want to mention, just as an aside, 2 things. Needham applied for 2 different grants in late June. One is a DPH shared services grant. Needham had applied as a member of an 8-town group, but we also applied separately as a leader of a 3-town group, which is Needham with Dover and Medfield, and that would share environmental health services if it was awarded. I think that one is a little bit of a long shot. We also applied for an epi and contact tracing grant where Needham with Dover and Medfield would share a nurse and contact tracer. A little bit more hopeful that we will get that grant, in large part because DPH is throwing quite a bit of funding at it because the CTC is going away. The first grant, there are only 5 awards left, and Needham is not an environmental justice community or doesn't have any portion of its community that's environmental justice areas. So I think we would get that if not enough people applied. I don't think we would be prioritized over virtually any other applicant. So I'm hopeful that those one or both of those would come through. The state budget did pass, and I had mentioned to the board that this was a possibility. State Representative Denise Garlick worked to insert into the budget some funding for the town and diversity initiatives, but also $50,000 to review the physical layout of the kitchen at the senior center and examine whether it could be modified or upgraded to do a higher level food service. So maybe breakfasts and dinners, maybe traveling meals. We do know that the hospital has been a great supporter of traveling meals. We also know that every time the hospital expands, the traveling meals program gets a little bit more squeezed. And they continue to be a great supporter of it. But to me, it seems long-term, it's hard for them they have a limited space available, and their food service needs are going up, and their ability to support traveling meals, I think, is going to be a continued challenge. So I'm very interested in trying to figure out whether the Center at the Heights could produce traveling meals and what that would take, and could we make it self-sustainable? Would it cost additional money? If it costs a little bit of money, we could fundraise or get funds from the town. If it's going to cost a ton of money, maybe not. I know the hospital doesn't make money. They charge the town, but they don't make money on the program. It's a loss for them, and that's part of their sort of commitment to the community. But in addition to that, there was also $50,000 for the health department to pursue accreditation. So both of those were included in the state budget. We haven't gotten any official award notice, but it was in the budget that was passed by the legislature, and it was in the budget that was signed by the governor. So I think that's just a matter of the state departments that handle those different money, which is Executive Office of Elder Affairs or DPH, getting us the paperwork. So those are very positive things. I think those grant opportunities and the state budget funding should just inform what we're thinking about for the board's other priorities for Recovery Act funding. Just knowing that maybe if we're going to say accreditation was a priority, it seems like we have some resources already set aside for accreditation.
Do you think that 50,000 is enough to get our application for accreditation in? Because it's 15,000, as I recall, from
Just to apply. Yes.
just to apply, and then we need to do another elder health survey,
Yeah.
which is going to cost something. I'm just wondering, like,
Lynn
not
is
do it, or do we need more than that?
Lynn is our point person. I think, yeah, the cost to apply for accreditation itself is substantial, but
I'm actually about to start look at a budget for that to try to come up with a cost for it. But I think $50,000 would go a long way, very long way, actually.
Oh, right.
Because you would need to, do you need to hire?
Yes.
Yeah.
it's all about staff time. I think, to oversimplify it greatly, you have to have a whole bunch of different committees that are working on things. And if you're in a big department, you could actually have people serve on one or two committees. But if it's our department, it's going to be everybody in the same, just whoever the chairperson of that committee is going to change, because there's only a small number of staff.
I envision one committee meeting for 2 hours and changing focus every half hour.
Okay, I think that's exciting. The select board did ask, as Rob said, for the Board of Health's priorities for potential use of Recovery Act funding. And I do think when that conversation was occurring, we were less concerned about COVID than maybe we are right now. And they did ask for whether the Board of Health has priorities or interest it wants the select board to try to consider incorporating into its goals and objectives. In the past, I've put in, with the Board of Health's input, a focus on funding for emergency management, so it's not kind of an unfunded mandate that's solely on the health department. That eventually came through with a funded full-time position, so that putting things in the select board's priorities does help. The Board of Health having officially adopted priorities, which it does, also help. That is when the town is doing its budget process. One of the key criteria that the Finance Committee looks at is this just a department head saying I'd like to have more stuff, or has an elected official or an elected body in the town said that this is a priority we need to work towards. So we have both of those things, but if we want to include things in the select board goals, that there's value there as well.
So have you submitted something to the select board for their discussion tomorrow? No.
Because we were going to try to talk about it here.
Okay.
Certainly, I know, Christina, you are very interested in youth mental health, probably generally, but especially following the pandemic.
Right. I mean, I think probably we all are. And so I've been connecting the past couple of months with Sarah Shine a lot. And so just yesterday I asked her, how many kids do we have on the waiting list now? And so we've had anywhere for about 10 to 15 waiting for certain counseling services. It's a lot. And what she said is in the time that she's done this work, the level of acuity of these children is the greatest she's seen. And so the need is great. We have more kids than we've ever had on waiting lists. And so I think this is a huge priority for the town to think about how are we going to meet the needs of these kids. And I imagine if things are moving in this direction again, we could see a greater need, as the fall progresses. And so I mean, I kind of want to think about it more even as a community level goal, so I wanted to bring it to the attention, in that meeting with the select board, that this is an issue because they were unaware. But I think too, just, for the schools, for all of us to really think about collectively, how are we going to address the needs of these children? And she said, the vast majority are middle schoolers, so they're getting younger and younger. And I know just anecdotally from talking to, my kids' pediatricians at Needham Peds, that they've said the same thing. They're having younger kids, 8, 9 years old, coming in with mental health issues. So I think this is a community level problem and issue that we need to tackle. And I would like to submit something to the select board tomorrow as having their priority setting meeting. I think it would be great if we could submit, come up with what our key priorities. I think that's a critical one, and share something with them for tomorrow.
One of the things I think that is valuable potentially because of the acuity issue is not just potentially additional staff time, but maybe some outside contracts that, our clinicians can't be expert in everything. And maybe if there's a particularly acute eating disorder or something, maybe there are some small contracts with experts, private clinicians in practice that, we retain some sort of standing agreements to say we've got, $10,000 a year of your time if we need to send people to you who have this particular situation or that particular situation.
I understand that, like, they're taxed, that every professional is
I think
maxed.
that's one of the challenges is that it's one of the challenges facing our interface program, which we found enough grants and donations to continue, which is great. But when interface is referring people to clinicians, there used to be sort of essentially, well, you have 3 options. You've got this person, this person, and this person. They're all accepting new clients. This one is, has evening hours, this one doesn't. And now it's sort of, it takes a lot longer to find one person. And if that person's, timing availability doesn't work for you, that's going to be very challenging because there isn't other options in the community. I think that's just a challenge that the mental health system is feeling. And I think I've seen coverage that there's been ripple effects, obviously, to hospital emergency departments in terms of even increased psych cases. Certainly won't help if St. Vincent is closing down some of its psych beds too.
Yeah, I mean, I've been thinking too, could we as a public health department kind of host some sort of a community level conversation on this issue, which kind of awakens everyone to that this is really, because it was really news to the select board members. I think that it's not, I don't even think a single, I mean, of course they need to see a provider, but I feel like that alone, especially because we're having a hard time finding providers, we can't kind of sit and wait for that. So where can we, bring in some other supports, maybe what can the schools do? Maybe other community groups,
Karen, I wanted to see if you could mention the program with Randy Schuster that you had spoken to Aaron and Tamitha about, if that's okay.
Yes, absolutely. And before I do that, I just wanted to mention, it's my understanding that BID Needham has just hired a new director of a behavioral health program they're starting. So I haven't met her yet, but that sounds promising as well. So just the other week, we convened a meeting with Dr. Randy Schuster at Mass General Hospital. She's a clinical psychologist and she works in their Center for Addiction Medicine, providing care primarily to adolescents and young adults. So we convened this meeting with the principals of the Needham High School, Pollard Middle School, and Tom Denton, who's the Director of Guidance, as you know, for K through 12. And Dr. Schuster had the opportunity to explain to them about a program called Project Arches that she's been overseeing now since about 2015. And the program essentially works in the school systems. It's through middle and high school. And she administers an online survey once a year to these students. It's all about mental health and substance use indicators. And the students who take the survey, which ideally it's most of them, have the opportunity to self-identify, meaning that they are giving permission to Dr. Schuster and her team to contact them if the results of their survey indicate either some propensity for substance use issues or mental health. In particular, she has questions that would flag pretty significant mental health concerns. And so with the survey opportunity, she can offer these students a free, confidential, and when I say free, not even requiring their insurance, free and confidential resources to services that she and her team provide. One of them includes a resiliency program for mental health for these students that do flag for fairly significant mental health indicators. And again, it's voluntary, but the beauty of it is that if students are interested in participating, the resources are really conducted right there on campus at the schools, where for most young people whose families are looking to connect them with those services would have to drive them into Mass General and have them access there. So it breaks down some of the barriers to access as well. So the good news is the principals really appreciated the opportunity and signed on for these programs. There is also a new diversion program as well that Dr. Schuster is offering. So just as a quick recap, this is a program that's an extension of her research. She's heavily funded, I believe, through multiple organizations, Mass DPH being one of them. And she's been operating in Boston metropolitan schools now since 2015. So we had the benefit of a few other principals from area schools offer some feedback of their experience with the program. And they were all resoundingly positive. So this is intended to not replace anything that the schools have currently operating. It's to augment and supplement it. So it's a very encouraging opportunity, and it's a resource that I think our young people obviously deserve to have that opportunity. And I was really pleased that our school principals saw it that way too. So,
any idea how many children the program can support?
You know, Dr. Schuster didn't actually cite any caps to the services. It didn't seem as though, in fact, she's adding to her team of professionals who are going to be helping. So she didn't indicate that, Christina. But
has she done this anywhere else, or is this a pilot?
Yes, no, this is not a pilot.
Okay.
She has about 11 other schools in the Boston metropolitan area from 2015 to present. And she was opening up the opportunity to more schools because, as I said, she's expanding her her staff, her team will be able to provide the services with her in the schools. So it's both mental health and substance use.
Is it in person or is it Zoom?
It has been. As I said, it's done right in the school, and it's still confidential to administration. So a student wouldn't necessarily have to be concerned about walking down the hall and feeling identified by administrators like, oh, you're in the Project Arches program. She handles it all very confidentially. And there's full like parental consent and all of that too. Dr. Schuster had really covered all the bases with us when she presented.
And it would start this fall?
Ideally, yes. Yes, hopefully. That's the plan.
Yeah, it's great to have something that's like a structure ready to go.
So we start with the survey and then go from there.
Okay.
That's really good news.
How should we communicate feedback to the select board before their priority setting meeting tomorrow?
Yeah, I'd be happy to I'd write up a letter. If there are other things other than this mental health topic that.
I mean, I think one of the concerns I have is just working through the town system always takes a little bit of time. So we were very fortunate to hire 3 contact tracers that Mary referenced. We started that process early and they arrived about 2 months after I would have actually liked them to be there. So I think one of our concerns is staffing if the pandemic does escalate in some ways. And I think there's a question about, how much, so if we're talking about hospitalizations are far reduced, deaths are far reduced, I don't know that that actually lessens the workload on local public health in terms of contact tracing and case investigation.
Especially not with the change
Right,
from the
CDC
CDC.
going away. Yeah.
So I think it's easier to say we're not as concerned. We don't know if hospitals are going to be overwhelmed this time, but I think that the potential for health departments to have quite a lot of work is still quite strong. So I think potentially COVID funding or contact tracing. Last year we begged and borrowed and stole from other sort of public health division and HHS programs to pay for everything. With Recovery Act funding, I would hope that we could return those funds that we used to their original purposes and rely on some specific money if we needed for contact tracing or other things.
And there is Recovery Act funding specifically for those things.
There is, yes.
Yeah. It should appropriately be used by the health department.
Yes, yeah. And I would cite that CDC guidance because it's important.
Maybe you could write me up a little thing on that. I figure if I don't say it now, I'm going to forget. So.
Okay. All right.
So Tim, do you want this to come from you or shall we?
No, I think it, however the board wants. If you all have different priorities, you can send them to me and I could compile them into a list. If we think that the priorities should focus on potentially staffing for COVID response, but also youth mental health, both in terms of individual counseling, outside expertise, but potentially also you talked about like community conversations or more sort of events or educational programs, Christina. So I think that would be a priority. I think that is definitely a priority. I know it's a priority of Sarah's, and I think the youth commissions as well. I think senior isolation and depression is an issue and concern. I think in the same way that we're very concerned about the impact of the pandemic on youth who felt isolated, who didn't have as many social interactions or connections. I think we also feel and felt that about the senior population. Our Aging Services Division did a very good job of switching a lot of their programs, of having deliveries to homebound seniors, but it's undeniable that there were mental health impacts of being isolated for so long, of not having personal connections. So I think
which don't just go away when the pandemic goes away, necessarily.
So I think
we're not even there yet.
I think all of those are potential areas where the board and the Health and Human Service Department think there's unmet need or there's the ability to do more.
Is there anything tied in with the Nuari principles that could get in there? I don't know what else. Like, I know some, like we talked about the mental health data, not including race, for instance, and things like that, like who's asking for services and knowing that information. I don't know, just something else to.
Can you get statistics from the social workers at the senior center, for example?
We can, although the information they collect is actually even more limited than youth and family services. So they do collect numbers. It isn't as easily broken down in terms of, 50% of the cases of people over 80 are related to XYZ, unfortunately. And as you know, Ed, one of the challenges or opportunities related to senior mental health is often that the senior is unwilling to directly bring that topic and say, I have this issue, I wish to talk to someone about it. Oftentimes they ask for help in some way with an application for a government program or getting something arranged or some services. And then after they build up a relationship with the staff person and feel comfortable, then they might bring up the underlying issue that's a concern.
But the social workers, I'm sure, have seen an increase in issues over the past year.
They have, yes.
And so they might have some statistics. They might probably a certain amount of anecdotal information in there too. But
I think one of my other priorities, I think Hannah Whitehead's done a fantastic job. We got a grant from the Metro West Health Foundation to hire an epidemiologist, and she's done a great job, collecting, analyzing data, but especially visually displaying data in a way that I think is easier to understand and visually attractive. And I think there's real value there. When the grant funding ends, I'd love to retain, and unfortunately, I don't think it's going to be Hannah because she has other arrangements already set up, but I'd love to retain that function of, data analysis and visualization. I don't know how realistic it is, but that's certainly something that I think is valuable, especially in terms of public understanding of some of the work we do. Being able to present it clearly and visually, I think really goes a long way.
Yeah, I think the dashboard helped people see.
Yes, and Hannah and Cindy Gonzalez and Kristen Scoble worked very hard on the dashboard.
Yeah.
And Mary and Hannah and Tiffany too, but
yeah.
Hannah Whitehead. And
Was that disappearing in some way because of our contracted ArcGIS or something? I thought I read that somewhere. Was that changing?
Hannah, I'm going to promote you back to panelist. I don't know if you heard that question. Christina asked about whether there was any changes to the dashboard in light of something with ArcGIS, and I got to be honest, I'm not sure. But the dashboard's still functioning, right? I know you guys did some recent revamps.
Sorry, I think I missed a piece of what you said when I was being reconnected, but yeah, the dashboard was just kind of revamped to kind of focus on some bigger picture trends given where we are in the pandemic.
But it's not going away.
As far as I know, it's not going away. I don't know what the timing is with the contract ending.
I think something is ending because Cindy mentioned.
Yeah, that does sound familiar to me as well. I don't know the timing on that, but yeah, I think if that is the case, then yes, I think that would affect this dashboard, and it might make sense to look into transitioning it to either, I know like Google has their own like dashboard platform, or Tableau. I've also looked into towards that. So yeah, and I think kind of getting a sense of what, and obviously it kind of depends where things go with the pandemic, but figuring out exactly what we want to maintain for the website, like what is most important in terms of a dashboard moving forward, could probably help inform like which platform would make the most sense.
And it's very easy to say all of it, but if we are concerned about staff resources, because I know it takes a substantial amount of time to work on it.
Yeah, and it can be a bit finicky. So I think, yeah, especially like any, significant changes in what kind of data we want to present on it can definitely take a bit of time to get set up. So, yeah.
Okay, thank you, Hannah. I'm going to move you back to attendee.
So there is Recovery Act funding for public health workforce, investments in that. And also with regard to your Nuwari question, this Recovery Act funding to address social determinants of health, which definitely an overlap there.
Yeah, that's good.
I certainly think, if the board is talking less about funding priorities and more about general priorities, I think that there are, and I wish we had better data on this, nutrition issues with some portions of the population that have more limited means. The Community Council has seen a sharp uptake in the services it provides through its food pantry. I'd love to get more data to better understand that challenge.
Yep.
I think there's also definitely, housing needs, housing affordability, housing accessibility. Thinking about seniors who are in homes that maybe are too large and maybe no longer safe for them. If they want to stay in the community, do they have any options? Like, is there an ability to downsize? If they're downsizing, are they getting something that is senior friendly in terms of one floor living or with an elevator or something like that? That's a very, very complicated issue that touches a lot of things, but I think a lot of it relates to, is there enough housing? Is there housing that's affordable?
As far as the nutritional thing, I was going to bring it up earlier, but this is probably a better time. It's Nourish Eat 'em. We got a new intern.
Yeah.
Shouldn't be just restricted to restaurants.
Okay.
People could be involved a lot more now.
Yeah. There's also the Meatless Monday initiative with the League of Women Voters that could tie
Okay.
in together
Yeah.
too. And there's a lot of people focusing on it, so I think.
Yeah, and Ally was actually planning on partnering with the farmers market again, and during the Harvest Festival, they wanted to do a food demonstration. So ideally, I think the idea was to buy fruits and veggies from the market itself. So from the vendors, show people like, oh, you can use these ingredients, integrating the market, and then showing them a healthy meal. So we will integrate more stuff like that.
Yeah, I think Meatless Monday is doing something similar, like
Yep.
the Needham Community Farm.
I'd love to at some point too think about school lunches because
Yep.
there's a lot of room for
That's-
improvement.
Yeah, that's state mandated.
That's always been true.
So
Yeah,
there
actually
is a
federally
new
mandated.
director of school nutrition services who I met just briefly right before I went on vacation, and cannot retain his name, unfortunately.
Colin.
Colin, thank you. There's potentially an opportunity for more collaboration there. There's also a new director of school health services. So we, unfortunately, Barbara Singer retired, and Barbara Singer was very valuable, I think, in general, but especially during COVID, and worked very closely with our team of public health nurses. There's a new interim director of school health services named Susanna Hahn. The schools had put out for director of school health services multiple times and had not received any satisfactory applications. They called me essentially right before I went on vacation, said, can you come meet this person? I was very, very, very impressed, and I'm really glad that they were able to hire her. So I think, hopefully get a chance to meet the board in the future, and we'll work with the public health staff. So I know, Mr. Chair, that we're a little bit behind time. I think the next item on the agenda was substance use prevention. So the presentation that Mary and Karen had alluded to earlier.
Yeah, so I can burn through this and try to make us up a little bit of time here.
I think it's an important topic that the board has expressed interest in the past about.
So this Narcan project actually was what I did my master's program on, my capstone project. And so this has been my baby for a while, and it started with the BID Needham Community Health Needs Assessment from 2020, or that was performed in 2019, so even pre-COVID, and it identified mental health and substance use as one of 3 priority areas. And as we all well know, that has just been made probably unmeasurably worse by COVID. That also, the other 2 priority areas were chronic complex conditions and their risk factors, which also made worse by COVID, and then social determinants of health and access to care, which also probably made worse by COVID. So I don't see this perception of need changing with the upcoming community health needs assessment. Unfortunately, in terms of mental health and substance abuse, it's very difficult to get good data that is opioid specific. And opioids are very much a hot button topic right now. We have had a couple of issues in the town that have been brought up to CCIT meetings. But in terms of actually getting data, it's kind of a battle. So overdose data is horribly outdated on the federal system. The CDC data, as of last week, still is only dated to 2019. State level data on NIH dates to 2018, and it still says that 2019 data is going to be due in spring of 2021. And then the Massachusetts DPH is released quarterly. And so the May 2021 update I've got here on this slide shows that 2 confirmed opioid overdose deaths for Needham in 2020, but those cases are still being confirmed. So this is just preliminary data. But I wanted to kind of show that this is something that has touched Needham. The problem with this data, however, is that people don't necessarily overdose where they live. And a lot of people who work in Needham don't live in Needham, and vice versa. And so restricting things to just who lives here doesn't necessarily impact who goes to our hospitals or who uses our pharmacies or who is on the streets here.
So
Also-
what do we know in terms of data? First off, obviously these 2 deaths in Needham, were these Needham residents or were these people who work in Needham?
From the information I have is that these are this says city of town of residents for the descendant is on that one. So those are 2 Needham residents
Right.
that we have for 2020 in terms of the state data.
And
Do you
the other
think-
question is, what's the prevalence in our surrounding communities?
So I've,
It's coming up.
yes,
And I do think Chief Schlittler in Needham, and Chief D'Entremont in Dedham would tell you that the position of the communities on 128 has led to a number of people that might not live in the community coming here, getting drugs and then overdosing.
Also, current limits to the data are, from my conversations with Eddie Sullivan at EMS, is that they've had a reduction in hospitalizations and an increase in refusal of services because people don't feel safe in the hospital with COVID happening. And so EMS calls also might not necessarily be able to capture all of the incidents. And then overdose deaths, if we're reporting overdose deaths, that doesn't necessarily capture people who recover after being given Narcan, or who people who don't necessarily have autopsy done to identify what the source of the overdose was. So I've been trying to get local data, both from EMS, Needham EMS, and then the local hospitals, BID Needham and Newton Wellesley, both collect this data. And so I've got a Venn diagram here from the data that I pulled through from EMS. So they track times Narcan is used, and then they track times that calls were opioid specific. And this is through May 6th. We've got another CCIT meeting coming up soon, so I hope to have this updated in the near future. But this would just be Needham EMS, nobody else, no other sources of information. But in terms of calls, in 2019, they had 8 opioid-related calls. In 2020, they only had 5. Year to date through May 6th, 2021, they'd had 3. In terms of times Narcan is used, Narcan isn't necessarily always used for an opioid. If they find someone unresponsive, it's one of 3 things that they do to try to wake somebody up. So even just tracking times that EMS used Narcan doesn't necessarily capture the actual instance of overdose. But in 2019, there was 10 usages. 2020, there were 20. And in 2021 year to date, there were 4. Now, in terms of when there was an overlap, that Narcan was used for an unresponsive person that was found to be an opioid-related overdose. In 2019, there were 3. In 2020, there were 2. And by May in 2021, there were already 2. Going through the BID Needham numbers, there were 16 overdoses from October of 2020 to March of 2021 of specifically Needham residents in the BID Needham numbers. However, I haven't been able to get that separated out for which ones were opioids. So I know for a fact one of them was Tylenol, and so I don't necessarily have opioid specific numbers, and I am working with the hospitals to try to get them to kind of suss that out for me in terms of what was the substance of concern on all these individual overdose cases.
That should be really easy. It's an ICD-10 code.
I
And they're
know.
all billing for it, so
Yes, sir.
that has to be a code.
That is my
challenging.
contention.
We don't think it's technologically challenging. We think it's administratively challenging to get the hospital to provide information.
I have been told by someone that, oh yeah, that will be very simple, and then I still don't have it. So
Maybe that goes into the community needs assessment, good data.
I think that's a good point, because they do have data, and I think pulling
Yes.
it is challenging.
Right, but I mean, that's something, for community needs, that's something we need, and that's something they can provide, and it's something that they're mandated to do under the ACA. So we put that in as a priority, and we might actually see some action on it.
Good point.
that would be lovely.
You could also get information from EMS as to whether they transfer the patient or not to either BI Needham or another hospital, if they did
Yes.
call in another town.
And so again, but that kind of goes into the data limit. So that'll tell me who Needham EMS took there, but not necessarily who got dumped on the emergency room steps by their friends or, you
Right.
know,
Yeah, no, it wouldn't
Yeah.
totally clarify the picture, would help a little bit.
But through all of this, I have been able to identify that the number is definitely bigger than 0. So there is some degree of opioid overdose issue in Needham. It's just very, very difficult to quantify with the data that I currently have available, even through months of kind of digging. So the CDC issued recommendations back in December in regards to overdose deaths and the acceleration thereof during COVID. Those recommendations include an expanded distribution and use of naloxone and overdose prevention education, expanded awareness about and access to and availability of treatment for substance use disorders. They recommend intervening early with individuals at high risk and to improve detection of overdose outbreaks. So I've been working to kind of put together a take-home naloxone program, which I have been working to collaborate with local EMS and hospitals to get this data. I want to add on to the town website opioid and Narcan specific information. Right now I'm working on getting my hands on actual Narcan to start a Narcan take-home training program so people could come into the come in and learn how to use it and then take home a carton to have at their use. But I also wanted to promote through town channels that Narcan is available at the pharmacies. I did one day sit down and call all the local pharmacies that are registered and are required to have it on hand. And through 4 pharmacies, I managed to find 3 cartons for sale, 2 of them at one pharmacy. So I don't know if that's a supply side issue or a distribution issue, like they don't have much on hand because not very many people are asking for it. But I think promoting that that's an option and that it's covered by insurance and that you can get it, should be able to get it same day, ideally would increase the demand at the pharmacy. I also wanted to specifically angle promotion at telling people that if you have a prescription for opiates, you should get a prescription for Narcan also, because not all overdose deaths are from illicit use or from misuse. And that's part of the reason why we see opioid overdoses happening more in adults, even particularly the elderly population due to opioid interactions with medications, so post-op and that sort of thing. I also created a presentation that I would like to take to individual shareholder groups, specifically veterans organizations. As an anecdote, my husband was prescribed a ridiculous amount of methadone through the VA. And that is something that I was kind of able to take as, you know, this is why, you know, part of the reason why opioids is such an issue is there have been, you know, people were being prescribed their addictions. And so not necessarily everyone will look at it as a substance abuse issue, but just I have a script for this. So I've been looking into a locker system also that would work kind of like a gym locker or a hotel locker where you can punch in a 4-digit code, and then someone could then come, we're looking at hopefully putting it in the at the RRC, where someone could request Narcan through a Google form or something else similarly and get it anonymously, give me their 4-digit PIN, and then I would respond back with it's in locker 5 and this is your PIN. They could come in, punch in the number and get it hands-free. Is something that I think would be great in times of COVID. It's got a 36-month shelf life, so bulk purchasing, even if there's not a lot of uptake at the beginning, we are not really running the risk of it going bad. And there's also recommendations that even if your Narcan in your purse is expired, still use it, because even if it's got a reduced efficacy, that's still a lot better than 0. And so there is, while we could give out obviously expired Narcan, there's no real harm in the community still using it if they have it. So, and then
One
the idea.
question about doing it in RRC. The way you're describing it, I think is fine. You know, it's just when I saw those sharps containers on the next slide, and saw something large, visible, and I thought, okay, you're going to have a Narcan distribution point that's large and visible, so the community knows it's there. And there are little kids who are, you know, traipsing there who are going to ask mommy and daddy, what is that? This sounds more like, you know, make a call. I'll put it in a, you know, in a pretty plain Jane locker. Come pick it up.
Yeah, which we could use for other things also.
Sure.
So we could use it for any contact-free delivery, which would, the idea being both, you know, contact-free in the time of COVID and anonymity, so that, you know, if somebody needs this, we don't want them to necessarily not get it because they're worried of who might see.
Sure. Okay.
But yeah, the idea also that we could use it for anything else that came up in that sense for contact-free delivery. With the idea that we could then pair it with the sharps container that Karen has been working on. So before I hop it over to Karen, if anybody had any specific questions, I kind of pared this down for time's sake, but this has been my baby for a while, so.
Great.
Fantastic.
Good program.
So one of the goals our prevention team's been focusing on is adding an additional sharps disposal container in the community. As you may be familiar, we have two of them. We have two containers located currently at our RTS, our recycling transfer station over on Central Avenue, AKA the town dump, which are housed in a little shed, and they provide some degree of anonymity for people to come in and out of it, but that location isn't always the easiest for everybody to get to. It's about 1.5 miles from the center of town. And I have been in touch with the RTS manager over there frequently, and he has seen an uptick actually in the filling of those two kiosks in more recent months, especially during the pandemic. One other sharps container is located in the lobby of the Beth Israel Deaconess Needham Hospital. And I think that has been there maybe going on 2 years, is there starting in 2019. So while we have these two locations, the addition of a third container would just provide that much more accessibility for disposal. And the proposal, as Mary indicated, is that we would like to put it in the vestibule at the RRC. And Stephen did just point out the visibility of them. You can see there on that slide the rendition that I've provided. It's actually the one that we're considering is the MW06 on the left. It's very visible, obviously, of course, but what we wanted to propose, or we're considering doing, is making this available, obviously, to anybody in the community. It would require that people come with their sharps, and that can be anything from syringes to EpiPens, other types of sharps. But they come with them in a portable sharps container that we can actually provide people free of charge. They're just small containers that they keep at home, because what we don't want are people disposing them loose into the container. You can see from the two pictures there on that slide that the drawer pulls out and it's caught into a container down below. This is pretty similar to what the RTS has as well. And in talking with the superintendent, the assistant superintendent at RTS, he has been more than gracious in supporting our efforts to put this kiosk there, and has offered whenever, if we run into problems with any kind of jamming of the kiosk, that he would assist us with that. And he'd offer any kind of training if needed to our maintenance staff if that came up. But by and large, we anticipate the waste management vendor emptying that kiosk bi-weekly. It would be added to the contract that they have currently for the RTS disposal sites.
So let me ask you a question
Yes.
about disposing the portable container, only because there's a waste issue here too, and a space issue for that
Right.
matter, because that's going to take up a lot of space. Is the issue from a safety one? You know, I mean, I deal with my wife, you know, is finger pricking. I mean, she's type 2 diabetic essentially.
Mhm.
So, I mean, we're disposing sharps all the time down at RTS, but we keep the lancets in a small Tupperware container,
Mhm.
bring them over, dump the Tupperware container, retain the Tupperware container, so that we're not wasting a lot of plastic every time. Also, we don't fill the whole thing every time.
Right.
So again, just in terms of how frequently you're going to have to empty it, like if you had a ton of Tupperware containers or something like that in that larger container, now you have maybe half the sharps that you could get in there. You're going to have to do it more frequently.
That's true. But to answer your initial question, it is about safety.
Okay.
So that when they fall into that inside container,
Mhm.
that we don't get spillage of loose sharps, that if they were put in loose, that could escape around the sides or whatever. Matt Demaray has said to me who works at the RTS, that it is a concern if people are dropping them off and putting them in the container loose. So the preference is to have them, even despite your comment about the space they take up, as well as more plastic in the waste stream. it's really a safety issue.
That seems more like a design problem with the disposing unit, right? I mean, the disposing unit should be able to be designed so that, you know, you put a sharp in the drawer, it cannot fall anywhere other than the
Right.
bucket. That
Right.
bucket is the thing that really needs to be taken care of.
True. I think one other concern too is that if people are dropping them in loose, there can be spillage on the ground even outside of the sharp container. He's noted that he has seen that happen as well. Generally, however, he said that there's been a pretty good compliance rate with people dropping them off. The people who do tend to know what they, you know, that they need to have them in containers. And the fact that they have two of them there generally provided some additional, obviously, capacity. So he had cited to me before the pandemic, they didn't generally fill two in a biweekly period. It's happening a little more recently, but that other one was really just a backup in case the first one was filled to capacity during the biweekly period. So.
I mean, where are the sharps going? I mean, this is one thing I just don't know about the waste streams.
They're ultimately incinerated.
Yeah.
So we're incinerating the extra plastic as well.
Mm-hmm.
Yeah.
I want to make sure those are biodegradable or safe plastics that we're, you know, handing out to people for containers to incinerate.
I believe they are. I'll certainly double check that, but we have some of them, don't we even?
Yeah, it's the sharps containers we use in the nursing, like that we were using in vaccination. That's what we've got a number of them.
What are the hours of the vestibule? Like, when can you get in there?
So that's, we haven't drilled down to the actual dynamics of accessibility by hours, but certainly during the day, our building is open until 5 o'clock. Our building locks at a certain time, correct, Tim?
Yes.
So I think, you know, at least seeing how the demand for this goes will be part of our consideration for access, you know, if it becomes a matter of needing to look at whether we keep it open beyond 5 o'clock for this purpose. But I think at least in our considerations of where we want to site this kiosk, having it in an indoor location is better than having it outside. We looked at that. Sure. And it just, you know, if we were to put it curbside at the RRC, it just didn't seem quite as safe. And we can keep a little better eye on the maintenance of it if it's inside.
Have we looked at involving the pharmacies in this effort at all?
Well, actually, our CVS on Great Plain Avenue has a medication kiosk for but we haven't approached them about the sharps.
Maybe we should.
Potentially, you know, we got a lot of pushback from the others, the other two pharmacies for the medication kiosks. The one that's in Great Plain really was the result of our efforts of contacting them numerous times.
Yeah, but it's a slightly different issue, right? Because
it is a different issue.
You know, the medication, they could be worried that someone's going to try to break in and, you know, and steal opiates. This would be a little bit different. This is more of a safety issue for who's ever handling this, obviously.
Right.
I get that, but you know, they're selling needles. They should be able to take care of needles.
Right.
And their hours are quite a bit longer
right.
than the RRC.
Mm-hmm.
So it's probably going to be more convenient, and you might develop more locations as well.
Potentially. I know that you can get a sharps container at your local pharmacy. Are you familiar with that too, Mary?
Never need.
Okay. I've seen them on display or up in their inventory at the pharmacies, but where they ultimately leave the responsibility is on the customer to dispose of them.
No, not to take away anything away from what you're doing here, just I mean, that might be additional and at hours.
Right.
Because you're saying the hours, it sounds like at RRC is going to be somewhat limited to, office hours, and people who are working and they're not necessarily going to be able to drop by during working hours.
Right.
Yeah, it's to improve accessibility without compromising safety.
Right. I mean, there is the benefit, at least at the hospital lobby where this one's located, where theirs is located, there's at least sort of unlimited access because it's open 24 hours. So,
All right,
okay.
do we have any questions, further questions for Karen and Mary? Great program update, thank you.
We're definitely running a little bit behind, certainly on a jam-packed agenda. There's a couple things that probably could hold off. I do think it would be important to update you on the environmental exposure Needham Crossing and to work on scheduling future board meetings because unfortunately, between August vacations, I think in the September holiday and holy days, we haven't really found a great time that works for everyone yet. So it would be good probably to have some quick discussion instead of going back and forth over email repeatedly.
Okay.
Do you want to have Diana give a brief update on
Yes.
TCE?
Yeah, I'll try to make
That'd be
it
great.
as quick as possible. So basically in June, we were contacted by Ramble, which is an environmental consulting company. They alerted us that there was so they were in there, asked to do additional testing because I believe the company who owns the Kendrick on 275 2nd Avenue, they were doing some sort of loan and they had to do additional environmental testing. They did testing, and in one of the empty apartments, they found a very high level of trichloroethylene, so TCE is how I'll refer it moving forward. So that set off, it exceeded the imminent hazard threshold that's set by the Department of Environmental Protection, so DEP. So then they just started testing. So I'm working in conjunction with Mass DEP, so the Department of Environmental Protection, and Ramble. They kind of teamed up and started testing multiple units in the Kendrick. So basically what the simplest way is that they found it in the northwest wing of the building. They tested throughout the building, did not see very high exceedances in other parts of the building. So it seems to be restricted to one part of the building. What's important to know is that there is a sub-slab depressurization system in the building. So ideally, that way that system works is when they built the building, it was built into the slab. Anything that was kind of off gassing, the system is supposed to vent it out outside of the building. It's never supposed to go indoors. So something is up with the system. DEP is very much involved, and Ramble also still continuing to do extra testing, checking on what's going on. But they are trying to figure out the source and figure out what's going on with that sub-slab system to repair it so that this doesn't continue. What was great, the owners of the building either moved out those people who were in the apartments that had the high hits. They were given the option to move out, or they were giving an air purifying system in their apartment immediately.
And by giving the option to move out, to move into a different unit.
Yeah, move into a different unit that they tested and saw, and like in other parts of the building, there wasn't anything. So I think what happened was in July, they put out the report and then it made it to the news. So I started getting calls from concerned residents, but Ramble has been great. I've just connected them to Ramble, kind of gave them the same overview. I had a map, which is in the packet that they gave us of like the preliminary testing. So what I personally was doing was, it's a little hard to see, but I'd ask like, okay, where in the building is your apartment? It seems like in this area, it's pretty low levels, but here's Ramble's number. They will do additional testing if requested. An update from this week, actually yesterday, Mass DEP went out to Charles River Landing because we did get calls from residents concerned since they saw it on the news. Charles River Landing is across the street on the backside of the Kendrick. So they were concerned if there was TCE in that building. DEP went yesterday, took samples on the first floor. And when they were asking about taking samples, they wanted it in rooms that didn't have, good ventilation, so like a closet or something in the lowest level. So it'd be worst case scenario type of thing. And I got an email yesterday saying that they didn't find anything there. So that's good to know. So it seems like they're still going to continue testing around other buildings. They tested the daycare that was across the street, didn't find anything there. But they'll continue testing. So they're just trying to figure out the source and fixing the system to continue reducing that issue. But it seems like the response from the building itself was great. And the fact that Ramble and DEP are still very much involved and open working with us. Like I've asked so many questions and they have given us all the information that we need, so. If anyone has any more specific questions, I can also, after the meeting, like share with Tim more of what DEP sent me that's on their online portal, which is public record that anyone can look up. So there was a link, so all the items that were uploaded to the EP, like any correspondences, it has some testing that was done in the soil pre-building the building. So you can see those lab results as well. But I didn't know if anyone had more specific questions.
I pulled down the reports. I'll look at them this week. It was just last night. So.
I think this is really just going to be an issue of fixing the mitigation system, or is this go beyond the
That's what
mitigation
it
system?
seems like. That's what I'm inferring from it, is that they're just trying to figure out where it's coming from and how to mitigate it
Where it's going, right?
and where it's going.
Yeah.
The plume modeling underground would be important to understand over the next decade or 3.
Right.
Yeah.
Yeah,
And I was told that the
particularly
building,
because,
Charles River.
I mean,
It's falling
the
to
select board knows about this, I assume?
Yes.
Yeah, because this has implications for businesses. in the
right,
area.
right.
I'm trying to think what was on that site before.
It's a gravel pit. It
Yeah.
looks like it's down hydrologically from General Dynamics.
Yeah, because I was gonna say, what was,
But General Dynamics wasn't really a manufacturing.
Yeah, but well, whatever. There's other reports in there. We can look.
because
at
on the site, there wasn't any reportable incidences like at that exact site. So they're still trying to figure out what's going on.
That's what migrated.
Yeah.
Either that or somebody dumped it surreptitiously.
Okay. Thank you, Diana.
Just briefly, Mr. Chair, we did include one page. The Department of Environmental Protection had a new grant opportunity that we're interested in pursuing about air monitor sensors. So if any board member has thoughts, we'd be happy to hear them. But I know Kathleen had sent some thoughts. Diana's going to be leading the application for that. But we're interested in testing potentially areas near the highway, areas along the MBTA train tracks, especially
Particularly when there's housing, so Madera would be like a perfect place.
Madera, I'd love to get a couple. Where the trains are idling in different places, we get complaints, and then potentially some school locations, I think. And maybe 1 or 2 public housing locations. I think we'll look into the cost, but I think if we didn't get the grant, we would try to find funding to support it from the operating budget. And then, Mr. Chair, we had tried to schedule, and the Doodle form cuts off the printout, but we hadn't really been able to find times in August that worked between people's vacation schedules. I had initially sent out, and this is probably in June, some schedule attempts, but Steve pointed out I had scheduled them, I think, for Rosh Hashanah, or at least some of the days were for Rosh Hashanah or right near Labor Day. So then I tried an additional one earlier this week, and it seems like we're still probably in some points where it might be challenging to find a day. So I didn't know if the board had a few minutes to look at its schedules together and come up with something for either August or September.
August is really not good for me.
One of the options potentially available is that you can still meet remotely. So if there was a need for, because of a development in the COVID situation or something else, we could always schedule an August meeting on the fly and people could do it remotely if that was needed. And then plan for potentially an in-person hybrid meeting for September.
I think that makes sense, especially
Yeah, I
big
think
changes in the
that's a good
numbers and we
idea.
end up being like Provincetown or something like that.
Yeah.
We can just meet emergently over Zoom in August.
I am out of town the last 2 weeks of August.
Okay.
I am too. So, I mean, but I could do a remote meeting,
Yeah, I could too. The only thing is, yeah, I'll be on the West Coast, so I think
Oh,
like.
okay. So not 8 a.m.
Right.
Yeah.
We'll
So,
get you on your first day, so you're up early anyway.
yeah. That's right.
I'll be in a tent
So
somewhere.
we'll keep that in mind. Last 2 weeks of August will be
Catch up.
3 time zones away.
Yeah.
And then the 6th of September is a holiday. And then I believe, Steve, the Jewish holiday.
The 7th of September is a holiday as well, yeah. Rosh Hashanah.
And then where is Yom Kippur?
16th.
16th.
Okay. So would we be better off looking for that the week of the 20th to 24th in September?
So none of the dates in the week of the 6th work, the 6th, like 8th, 9th, 10th, those don't work for people.
I'm sorry.
The 8th, 9th, or 10th for September, those don't work.
9th and 10th, I could do evenings only. I'm doing the ABEM exams, so I'm gonna be tied up the whole day.
And that probably the evening.
I don't know, I haven't done the remotes yet. It's all remote.
Yeah, I ended up being an alternate. I didn't
Oh,
choose me
so-
in April, so I'm signed up for October.
So
I don't know how-
do they have an evening thing? Oh, we have team meetings.
You do, but it's, there were people that I knew that were actually able to do like afternoon shifts, even though they examined all day, so. It doesn't mean
I
your
just
whole
don't have my
evening may not,
schedule, yeah.
yeah, your whole evening may not be.
So anyway, so that's the 9th and 10th for me, sorry.
What about the eve? I was gonna suggest the Wednesday the 8th, the evening.
I
I
can do,
can't do Mondays or Wednesdays all fall.
Okay.
At night.
What about the 14th or 15th?
yeah, I can do anything.
I could do
Evening,
evening
yeah.
on the 15th. Actually, no, I can't. I'm doing a presentation. Yeah, I'm busy all day, and then it's Yom Kippur stuff evening.
Again, the 15th, yeah.
So I guess we are up to the following week.
Now throw out the 23rd.
I'm available.
It's my one day off.
What would you rather be doing?
Exactly.
Yeah, we can do that, maybe an evening.
I mean, I could
I could do any time on the
that or
23rd.
do
Well,
that.
maybe if we're trying to
Friday
be more
morning,
accessible,
do the
try to do
24th,
it.
Friday morning. That works too.
Yeah,
Evening's fine.
Yeah.
So the evening of the 23rd, how does that?
sure.
Thursday, the 23rd.
It's like 2 months from now.
Yes.
That's,
I know,
what's the
I-
date on that? I mean, the time, did we pick a time? 6, 5, 6.
Could probably do
Like whatever time the board prefers.
Doesn't matter to me.
6 or 7,
Sure, let's do 6.
Okay.
6 p.m.
Okay.
Okay,
that. That's the 23rd.
yes.
Mhm.
And that's so far out that I anticipate we may have a Zoom
Yeah.
emergency meeting sometime between now and then, because it's 2 months away.
Alright, then I'll send out doodle invites for October and maybe November, or do we want to go October, November, December? I know that's pretty far away.
December's getting pretty far out there.
How about through November?
Yeah, I have my October schedule. I don't have November yet.
I don't have it, so. But I can make that happen.
I can't make mine. I can make December over the next 2 days.
Is there a day in August that I'm the bottleneck? Because I can just work around it. Like if there's an evening, I'm just concerned about going that long.
Um,
Did we
August.
already talk about-
So
Yeah,
you said the last 2 weeks you're away. We could
but
work.
you could have a meeting if we can't make it work, I'm available.
Right, but could
We
do
could do that
remote.
9th week, or, yeah, or we could do maybe evening remote.
There.
We don't have, do we have a? So I mean, yeah, I don't know, week of the 16th, is there anything that works for people?
Well, you said you were away,
I
right?
leave the 16th.
Oh, you leave this, yeah, I'm away too, but,
I could do evenings 17 through 20.
mhm.
I could do the evening of the 17th.
How about you, Tuesday? Oh, you can't do August, right? So you're too-
In Yellowstone, so.
Yeah, right. Yeah,
I
that's
don't
not gonna
know,
work.
but
Yeah,
I
okay.
can, let's
Yeah,
get, we
no,
can
I
get
just-
something on the books.
I do love the potential comedy of Christina's on Zoom being chased by a bear.
Yeah, right. With your headlamp. Okay.
I did have wireless signal last time I was there.
You
last
did?
July, 2 years ago now.
So I have a,
They haven't.
Okay, so the
Yeah.
17th, shall we
17th is
put
good or
that
not
down?
Yeah, I could probably.
what do you think?
that.
Yeah, I
August
can do it.
17th.
Yeah,
Yeah.
I'll make that work. What time are we thinking?
2 to 6?
6, make it like a
5 or
1,
6, yeah.
5 or 6, make it like a 1 hour.
Sure.
Okay, and we'll kind of pencil that in as a potential emergency meeting, or should we just do it?
Hey, we could do it.
Sure.
Yeah.
We would do
And
it
they
by
could do
Zoom.
that remotely?
Yeah.
Yeah, I would have to
Yeah.
do it remotely.
I think enough of us would be remote, so I think we should just do it remote.
Sorry, did we say 5 or 6?
I think we said 6.
6, okay.
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 All right, so with that, I guess we will move the further noir discussion until the next
Sure.
meeting.
Yep.
And I think that would, topics for upcoming meetings, we touched on a little bit.
Yep.
At least the pesticides and fertilizers.
Yep. So we're also going to get mental health in for a September meeting. I've asked Sarah Shine to present. So I think we'll probably hear about youth mental health, water quality, and well regulations.
Okay, and maybe we, for August, maybe we should just put Noiry kind of close to the top so we get to it.
Sounds good.
Okay, so with that, a motion to adjourn?
So moved.
Second.
Okay, all in favor?
Aye.
Aye. All right, thank you very much, everyone.
Thank you.